It may seem strange that psoriasis, an inflammatory disease that causes skin inflammation, redness, and scaling, can also trigger coronary heart disease. Isn't it true that psoriasis of the heart doesn't exist? However, one of the most common misconceptions about psoriasis is that it is solely a skin disease. No, there's more than that. Take note of this. Welcome to Scope Care, a safe and therapeutic place for patients and caregivers of all ages. Before we dive into the hidden connection between psoriasis and heart disease, make sure to subscribe to the channel and give thumbs up to this video. Keep watching this video until the end. Let's start with a brief introduction to psoriasis. Psoriasis is an autoimmune disease that affects the skin, and as with all autoimmune diseases, your immune system destroys healthy cells, including skin cells. In addition to scaly, red, and painful skin, psoriatic arthritis can occur, in which the swollen, painful joints of arthritis interact with the itchy, scaly red skin of psoriasis. Cracked, dry skin can also become infected. Psoriasis, however, is more than meets the eye. For some years, experts have identified a hidden relationship between psoriasis and heart disease. What exactly happens in psoriasis? A skin cell normally grows in 21 to 28 days and moves to the surface, where it is lost in a continuous, invisible shedding of dead cells. The cycle of skin cells is much faster in patches of psoriasis, about 4 to 7 days, which means that even live cells can reach the surface and pile on with dead cells. Wherever it occurs on the body, this mechanism is the same. The severity of psoriasis and how it affects a person differs from one person to another. Some people are minimally affected, with a little patch that doesn't bother them, while others have huge, visible patches of skin that have a massive effect on their everyday lives and relationships. The cause of psoriasis is unknown, but there are some factors to consider. A poor immune system reaction causes your body to produce too many skin cells in psoriasis. These excess cells build up on your skin, forming scaly plaques. The clogging of blood vessels causes heart disease with a different type of plaque, restricting blood flow to the heart. A heart attack or heart failure can result from a blockage in blood flow. So, what are the similarities between these two conditions? It turns out, quite a lot. Both psoriasis and heart disease are caused by inflammation. If you have psoriasis, especially if it's moderate or severe, you're more likely to have heart disease. Psoriasis patients are also more likely to have risk factors for heart disease, such as high blood pressure, diabetes, obesity, and smoking. If you've been diagnosed with psoriasis, there are a few things you can and should do to safeguard your heart to protect your body. Treating psoriasis is important. Several psoriasis treatments are dual purpose. First, inflammation is reduced, which clears your skin and protects your heart. Some biological anti-inflammatory medications, such as Enbrel, Taltz, and Stelara, as well as methotrexate, an immune system suppressant, are among them. However, your decision to take one of these medications is based on factors other than your heart risk. You and your doctor should think about your overall health, whether the drug helps your psoriasis, and what adverse effects it has. Other psoriasis medicines, such as corticosteroids and non-steroidal anti-inflammatory drugs, NSAIDs, have increased heart disease risk. If you have a history of heart disease, we advise you to avoid or limit the use of these medications. By addressing the following factors, you can lower your psoriasis and heart disease risk. Number 1. High blood pressure. Hypertension, or high blood pressure, causes the blood arteries that carry blood around your body to narrow and eventually block. It also puts more strain on the heart, which could lead to a heart attack. Furthermore, extremely high blood pressure can cause blood vessels in the brain to burst, resulting in a stroke. Because hypertension often has no symptoms, it's important to get your blood pressure checked at least once a year. Number 2. High blood cholesterol. Cholesterol and triglycerides are fats that are necessary for proper cell activity, but they can also shrink and block blood vessels, resulting in a heart attack or stroke. A high-fat diet, smoking, inactivity, and a family history of high cholesterol are all linked to high cholesterol levels. Eating a well-balanced diet, exercising regularly, not smoking, and limiting salt and alcohol use can all help to lower cholesterol levels. Some people may additionally need medication to keep their blood cholesterol under control. It's important to remember that the liver makes cholesterol, so some people still need medicine to lower their blood cholesterol levels even with a low cholesterol diet. Individuals with and without psoriasis have the same goal of a healthy cholesterol level. If you're enjoying this video, please give us a like and subscribe to the channel Scope Care to watch more informative content in the future. Let us know if you have any questions in the comments section below. Number 3. Physical inactivity. Inactivity can increase your risk of heart attack and stroke by double. You don't need to engage in intense exercise to reap health benefits. Start by setting a daily goal of 10 minutes of action, such as walking or gardening. Increase the amount and intensity gradually. Consult with your doctor if an activity causes you pain or if you are unsure about starting an exercise regimen. Number 4. Excess weight. You may be at risk for heart disease, high blood pressure, high cholesterol, and diabetes due to your weight. There is also evidence that nutrition plays a part in the growth of psoriasis and its treatment. For example, people who carry their weight in an apple-shaped pattern around their middle versus a pear-shaped pattern around their hips are more prone to have cardiac problems. Even a small amount of weight loss, as little as 10%, can reduce your risk of heart attack, stroke, or diabetes, while also improving your general health. Is it possible for you to eat more fruits, veggies, and fiber? Is it possible for you to reduce your intake of saturated fats and processed or sugary foods? You can improve psoriasis and make your heart healthy by eating a healthy diet and doing light exercise, such as walking. Weight gain from a sedentary lifestyle might affect your psoriasis symptoms as well as your heart health. Every week, all people should participate in at least 150 minutes of moderate physical activity, such as brisk walking, or 75 minutes of vigorous activity, such as running or swimming. What this looks like in practice is 3 to 5 30-minute fitness sessions each week. Here are some pointers to get you started. Choose an activity that you enjoy so you don't lose interest. If you do happen to lose interest in one activity, switch to something else. Break it up. Take 3 10-minute walks each day, for example. Sit on the floor and stretch, or walk around the room doing commercials while watching TV. As much as possible, go for a walk. Don't take the nearest parking spot. Park further away to fit in some extra steps. Opt to take the stairs over using the elevator as often as you can. Another factor is a healthy diet. Diet cannot cure or prevent psoriasis, according to the National Psoriasis Foundation. However, it can help with psoriasis symptoms and minimize the incidence of comorbidities like heart disease. In addition, people with psoriasis symptoms who are overweight or obese are also at a higher risk of heart disease. Make sure you're eating a heart-healthy anti-inflammatory diet. Fatty fish, lean meats, low-fat dairy foods, and plenty of fruits and vegetables are all part of this plan. It also includes limiting alcohol, sodium, processed meals, and partially hydrogenated vegetable oils and trans fats. Number 5. Check your routine. A lot of the same generally healthy habits will help protect your heart while also reducing psoriasis flare-ups. Make sure you're eating a well-balanced, healthful diet, exercising on most weekdays, dealing with your stress, maintaining your weight in the recommended range per your doctor, being a non-smoker or quitting smoking, keeping alcohol use to a minimum or abstaining from it entirely. Medication for psoriasis is one approach to minimizing your heart risks and avoid a heart attack or stroke. Take good care of your health daily, focusing on combating inflammation with diet, exercise, and other healthy living strategies. Number 6. Quit smoking. As mentioned above, it is well known that smoking increases the risk of heart disease. It also raises the chances of psoriasis flare-ups. Many people struggle to quit smoking, and medications combined with therapy can increase your chances of quitting for good. This brings us to the end of today's video. I hope you found the content to be both informative and satisfying. Do you have any questions regarding psoriasis and heart disease? Let us know in the comments section. Don't put your health on the back burner. Keep watching Scope Care for more exciting content and updates on a healthy lifestyle by subscribing to the channel. Thank you for watching this video. See you in the next one. Stay healthy, stay cool. Bye.